Okay, welcome to our newest podcast video thing. We're using Zoom today, and we've got Miriellys here with us. I'm pointing because that's where you are on my screen compared to me. I've got
down here,
these are the little. And obviously Deanna, who is here, and she's in sunny California. Sitting by the bridge, whatever bridge that is.
The Golden Gate Bridge in Northern
Golden
California,
Gate Bridge.
but I do not live in Northern California. LBC.
She's sitting by a very impressive looking bridge there, and a nice sunset. So yeah. We were gonna talk a bit about your experiences, weren't we? Layli.
Yes, close. Very good. You almost had it. Lily is in the Instagram. Lily26 is the Instagram name, and then my name is Miriellys. So I should introduce myself. My name is Miriellys. I'm 39 years old. I'm Aerilyns' mom. Aerilyns is 6 years old. She has Trisomy 13 is her diagnosis, and we also have diagnosis of monosomy 15, which is the other genetic issue in our I guess diagnosis. And then there's a bunch of other diagnoses that kind of trickle off of that because of her genetic chromosome issues. So that's us.
But say that you have the experience because she's 6. And our littles are 2.
Yes. Well, I don't want to say that I'm like, I have so much experience, like, but 6 years in, there's been a lot that has happened, and, both good and bad. And it's just kind of a learning experience, I guess, for all of us that get a trisomy 13 diagnosis. And like, I've learned from everyone else, including you and Larry, that even though we do have the same trisomy diagnosis, other things can happen, and it might present differently in each child. So Aerilyns has a lot going on. She keeps me busy. But thank God we're 6 years in, which is great, and it's a miracle and it's a blessing. And I know that you celebrated 2 years with Gracie, and I remember that milestone, how big it was for our family. So congratulations.
Thank
you. Huge milestone, isn't it? When you hit that, it's just like, wow.
It's huge. It's huge because we all kind of experienced the same thing when it came to, receiving the diagnosis and then getting that dismal kind of like definition of it from the doctors. Like, okay, well, this is, our life expectancy is not going to be good, and mortality rate is high. And so, our experience was pretty tough. We had, I was pregnant, I think I was 26 weeks. And, that's when I heard her, when they were going through the sonogram, and they saw that she had a cleft lip issue going on there. And that prompted them to do the emergency amniocentesis. And then the results came back that Aerilyns was going to have, her diagnosis was going to be trisomy 13. So, and then from there, everything kind of spiraled. So
you got that really late. That's much later.
It is much later. We did. And the funny thing is that it's a trisomy 13, and I don't know if you guys know this from the Instagram, but we have family members on my father's side that have trisomy 13. We've had, so Aerilyns the 5th child. And Aerilyns the 5th child in my family with trisomy 13. And,
wow.
We've had loss. We've had a lot of loss. And so, and everyone has been different. Everyone's presented differently. Aerilyns the only one that was born with a cleft lip and palate. Not with the palate, but with the cleft lip. And, she eventually needed the trach. And there's been a few other things that is for her was different from the other children in our family. So people kind of assume that, oh, well, you knew and you had it in your family, so you kind of had an understanding of what it was, but we didn't know. And we didn't know how far, to what extent Aerilyns' condition was going to take us. So, when I remember the doctor asking us, well, you have a very small window and you need to make a decision. And we were like, oh my God, that was a horrible thing. And I think that was the lowest point of our basically lives, to kind of be told by a professional that, professional in the medical field that there's nothing we can do. And basically continuing a pregnancy like this would be a burden on your life. So the best bet would be for you to have an abortion. And my husband and I are, our faith is very strong and we believe in God, and we didn't take that route, thank God. And so it's been a journey. It's been a crazy journey, but Aerilyns has taught, and like your children, and you guys are learning so much, so that's it. That's what I got.
What was the birth like? How did you have many sort of problems at birth with Aerilyns? Or
no, believe it or not, Aerilyns, she was born natural. We didn't. I had the pain. I was like, please give me an epidural. Not an epidural. The other one, the one that makes you not have pain. She was natural. She came natural. She was small. She was 4 pounds, 6 ounces. She was in the NICU for a couple of weeks. So she was born March 29th, and April 15th was when she was released from the NICU to bring her home. She had a lot of issues in the beginning, like when she first came out, they had to give her oxygen because her saturations were low, and she was having I know that you guys in your last videos were talking about the breath holds.
Yeah.
And Aerilyns from the beginning started showing signs of breath holding, and so that was one of the biggest things that kind of led the doctors to believe that Aerilyns wasn't going to make it, through the night or through the week or through the month. And so we brought her home under the assumption that, to bring in hospice and to kind of walk us through what they assumed were going to be like the last days of her life. And, it's hard. It was very, very, very hard in the beginning because there was a lot to try to understand and not have the answers to. And a lot of it was just leaning on her and letting her kind of lead the journey, because we just didn't have any directions. We didn't have anyone pointing us where to go or what to do. Eventually, when time went on and she was still here, we were like, well, we need to have an action plan. And we got her pediatrician. I mean, she had a pediatrician from the beginning, but case managers got involved, and then the fight to try to get nursing in the home. And then she had surgeries. Her first surgery was the cleft palate at, I want to say 6 months. No, sorry. Her first surgery was the feeding tube at 7 days. That was her first surgery. I think, was a couple of days old, and she rolled out, into the OR. And then when she came back from the OR, she had this huge button sticking out of her stomach, and she was 4 pounds, and the button was huge.
Oh my
so
God.
It was a huge shock for me, because when they were presenting the surgery to me, they said, well, they brought up a Cabbage Patch Kid, and the Cabbage Patch Kid is like average size of a Cabbage Patch Kid, and it had a G2 button, and they were like, well, this is what it looks like. And the button compared to the doll was very small. And I was like, oh, okay, that's not a bad thing. And when Aerilyns came back from surgery and she was in the room, in the bed, my jaw dropped because the button was the size of her stomach. And then she had this huge incision coming down her chest. And she was so small, so tiny. And it was a horrible thing to see. You know, it was tough. It was tough to swallow, the first surgery. And then the second surgery to repair the cleft palate was tough too. We were in Children's Hospital Philadelphia, and you know, it was a lot of little complications after that because she was swollen and she couldn't breathe and she needed a lot of assistance breathing, and it was a mess. So it's been a lot. We've had a lot of surgeries. She has a lot of implants. Aerilyns has a feeding tube. She has a port.
Sorry, if there was noise, by the way, there was stuff going on in the background. I had to mute myself.
Right.
Yeah, so I was, you know, I was just saying, you know, with the surgeries and stuff like that we've been through, and the different devices that Aerilyns has implanted. She has interventional devices. She has the G tube, GJ tube. She has a port. She has her trach. And then there was something else. Oh, and then the VNS was the most recent surgery. So, you know, she's medically involved, and a lot of those decisions had to happen because we had to intervene. There was a lot of health issues that were happening. That it is hard to make decisions for these kids. It really is. It's such a hard thing to do as a parent. But at the end of the day, we did our best to kind of make the decisions and see how well she tolerated and not to push it, because as long as Aerilyns was doing okay with it, then we would push it to the next level and try to help her along. But it's hard. It's a hard diagnosis. It's hard, but it's a beautiful, you know, it's a beautiful diagnosis as well. As you guys know, there's so many blessings that come and so much joy from these kids.
Very rewarding, I find. They're very rewarding children.
I have a question. So,
Yeah.
how have the doctors been since, you know, birth, knowing that now she's 6 years? Are you with some of the same specialists? Have they seen that progression and, you know, been amazed? Because I know I would definitely be amazed to see someone, you know, excel. And
They have. Yeah, it's really interesting because there's a very different tone from the beginning of our journey until now with Aerilyns. Because I remember in the beginning of our journey, it was the doctors telling me what was going on and what to expect, and basically putting the expectations out there. Like, well, you know, this child is not going to be able to do this, and there's no way we can do that. And I don't know, Mom. I don't know if we can. You know, the tone was very. I don't know, I can't even explain it, but there was a lot of resistance to what they thought that she was going to be able to do. A lot of her specialists, thank God, have been with us from the beginning. There have been a few of them that I've had to, you know, I'm sorry, it's not working out with us because either they were just rude, and I think you guys experienced maybe some of it, where you have a specialist or a doctor where they seem kind, you know, the things that they say is condescending, and just the tone and the way that, you know, they deliver the information to you. Oh, it says this meeting no longer has time limit. Oh, I don't know what that means.
Yeah, I don't know. I just got that come up as well.
Yeah, so going back to the specialists and stuff like that, so a lot of them are still the same. There was some that we had to let go because just, you know, the communication and stuff like that wasn't very good. And so they're very amazed. They're very happy when we go into the doctor's office. They're like, oh my gosh, she's so big, and she's so, look at her hair. And oh, I remember when she was so tiny, because, you know, when we first started,
she's always got her big bows in.
Yeah, exactly. The bows are as big as her, when we first started. Now it seems to even out.
I love the Christmas tree of
The
bows.
bows, it's like her
Yeah,
trademark, isn't it now?
oh, that's her. Oh, and you know what's so funny? So the bows is an interesting thing on how that came about. Because Aerilyns was born with a significant cleft lip, she had a huge gap between her like it was on the right side, but she had a huge gap. And social media is different from what it is now. You see more, you're more exposed to seeing a lot of children with facial differences and stuff like that. Back, I don't know, 2014, it wasn't really like that. So I wanted to bring attention away from her mouth. So her grandfather got her this huge flower headband, and it was so big, and it was really pretty because it had diamonds in the middle. And I remember the first time that she wore it to an appointment. Everybody was so busy with the flower and the diamonds in the flower that they didn't really see. I mean, they saw the cleft lip, but that wasn't the focal point. So from then on, Aerilyns headbands and hair bows and have multiplied by the hundreds.
I think
Like
when we started in this Trisomy 13 world, I found that I was very conscious at first with Darcy's differences and the way people would see that or react.
Yeah.
You know, like the extra digits and things, for example. It's like, but now I'm just like, look, 6 fingers, you know. It's,
Exactly.
but to start with,
Right, she gets 6
is we each have like something different.
Yeah.
Because Grace's eyes are the smaller set eyes, and everybody would always ask, like, is she sleeping? Is she always asleep? Yeah. And I'm like, no, she just has smaller eyes. They're there.
They're there. Yeah.
I mean,
and so that's how it is, you know. In the beginning, you feel a little conscious because they look a little different. They're not the typical child, and so it was hard for me in the beginning to kind of share that. And once you know, with the whole thing came about with the flower in her head, and it seemed like everybody was so impressed by the flower that they overlooked the lip. That kind of became Aerilyns' then trademark, you know, to always wear big hair bows and, you know, and just be very colorful and bright. I think it brings a lot of joy to everybody that we see and meet. You know, because Aerilyns has either, you know, you can see just like her outward appearance with the trach and the vent being attached. You know, you can see that there's an issue there. And some people are, you know, I don't know how to explain it, but some people just have a hard time trying to accept or just feel uncomfortable. And so her colors and stuff like that kind of, I think, break that you know, that wall that some people might have.
yeah.
And you know, so yeah, it is what it is.
I noticed one thing with you. You have like an army of equipment and pills and stuff,
Oh,
don't
I do.
you? And I've seen a lot of your posts on
do.
Instagram. It's like I'm always there, like, wow.
It's a packed day. It's a very packed day.
It does get. Sometimes I don't even know how this all came about, because I say to myself, oh my goodness, there is equipment here that belongs in a hospital, and that usually in a hospital, you have a technician for each and every piece of, like, you know, that, you know, the nurses do the majority of the stuff, but then the respiratory stuff that me and Dee usually work with is a respiratory therapist that have to deal with that. So we kind of have a double education, and so it's a lot. You know, Aerilyns has all types of equipment. She has her suction, she has her vent, you know, she has her feeding pump. The other day it was so funny. 3 of our equipment broke down around the same time. And I say equipment like the wheelchairs and equipment, but it's not. The wheel came off, so I had to call the DME company for that. Then the pulse sock stopped working, so I had to call the DME company for that. then her feeding pump stopped working. So all back to back to back. That was Wednesday, Thursday, and Friday. We had to have technicians come at all hours of the night to try to fix our stuff. So
these children are very high maintenance, aren't they?
oh yes, yeah, they are. They are. I mean, I always joke and say that Aerilyns, because a lot of people like Elias is at grandma's house. They're like, oh my gosh, at least you have one kid down and this and that. And I'm like, you know what? I have to be honest. Aerilyns is a lot easier than Elias. She's high maintenance, but Elias gives me a run for my money. Like Elias is, Elias makes me work, believe it or not. Aerilyns is very quiet. She's very low key. As long as she's, her numbers are good, she's fine. She doesn't talk back. She doesn't have an opinion for everything. So, I always joke around and say that, and people are like, how is that possible? She has so much going on. And it's manageable. And for me, I feel like it's manageable. I think we all kind of have to, in order to survive, fall into a routine of, having a routine and a schedule. I think the thing that helped me a lot was that, I had to put a schedule together. I said, okay, well, I have nursing from such and such time, medication from such and such time, therapies from such and such time. Everything has to be organized in a way.
You posted your whiteboard, didn't you, with all the...
Oh, I did.
The routine.
Hold on 1 second. Well, I'll show you a few of them. I'll show you a few of them. So right now, this one, I don't know if you could see, but this is my med sheet.
Yep.
Wow.
This is my med list. So this is all of, so it goes from 8 in the morning all the way down to like 10 at night. And then these are all her meds. So I have this out. I mean, it's sloppy because we cross it out and we do a lot of rewriting and stuff like that. Things that have to be updated. So this is a couple of years old. I got to change it. But you can get an idea of this is just medication, because Aerilyns also does respiratory treatments, and she does. I'm gonna walk you through my messy house. I'm sorry.
We with Darcy, we don't have this immense amount of drugs that a lot of people seem to have. We're kind of lucky in that sense.
Yeah. It's hard because with Aerilyns, a lot of the stuff, like a lot of her meds, believe it or not, is more respiratory, like to prevent. Like she has the albuterol, she has ipratropium, she has this sodium chloride, all for her chronic lung disease. And then she has a couple of other things, which is like she has Prevacid for her tummy. She has folic acid, vitamins, vitamin D. I
was going to say we use a lot of vitamins as well. I feel that their bodies need it, don't they? Like.
Yeah,
really.
I feel like the better.
Yeah.
Yeah, exactly. A lot of the stuff is supplements. Here, I wanted to show you guys. So then on the side over here, I write the appointments down. So we finished a bunch of appointments, and then we had to do a bunch of other appointments. I had to write them down. And then I have a mess. Excuse my mess. But this is the table. This is my table of stuff. And then we have a calendar here, which has a lot of dates and of appointments and stuff like that as well. So it's it's a lot. And then on the side of Aerilyns' bed, she has her vent. This is her sleep safe bed. Her feeding pump. We just got a Hoyer lift going on here. So that's cool.
Wow.
And
it's like a hospital, really, isn't it? It's like a little hospital at home.
Yeah, we, it's funny because a lot of the routines and stuff of the hospital, I adopted some of that stuff and brought it home because it made it easier. So I noticed that, all the nurses, they had their supplies, everything all in their little, I guess call it trolley with, with all the stuff. So, like I said, I kind of took some of their routines and the skills and the stuff that they do, and I kind of brought it into my home. And with my team of nurses and stuff like that, we have it literally feels like, they're coming into work. This is a hospital setting. We do what we have to do. Obviously, it's very personal. We love each other. Everybody's great. Everybody's like family. But my nurses work. Like, they don't play around. They really work, and they do what they need to do for Aerilyns. And so, yeah, we've managed to we thrive with the help that we get. So
That's
yeah.
good. I wanted
It
to
makes
ask.
a difference with the help, for sure.
It really does. It really does make a difference, because the first year, so it was hard. I don't know, Dee and Larry, if you guys have nursing at home and stuff like that, but it was hard for us to get nursing to begin with. I spent an entire year, the first year, for me to receive nursing. So if you look at Aerilyns' growth chart, she was like at the negative almost. She was thriving, failure to thrive. That was the label that they give them. And so she was failure to thrive for the first year. And then once nursing started coming in and started working with her around the clock, then you can see her growth chart climbing. And you've seen her gain weight. And not that she wasn't, not that we weren't trying, but I was, the first year of Aerilyns' life, I was like exhausted, like it's hard to do it by yourself. Let's just put it that way. It's hard to do all of this by yourself. There's no way that you can be okay if you're not getting the help. And so, and I think it goes all the way around with, internet support, with the support of you guys and other families that are going through similar journeys, and the support of the people in your lives, your family, and the nurses and the doctors and the therapists and the school. So, yeah.
we get it, because we have similar respiratory stuff that we have to do for Grace too, so we share that commonality, and she's got her med schedule as well. I love the idea of having a whiteboard of the upcoming appointments, because I don't have that. I usually just tell them, oh, here's the appointments for the week, so that might be something I'll incorporate. But yeah, whiteboard of med schedule. But it is true, when you have,
it really does help.
When you have a child with, that has extra needs, that first year that you're learning them and getting to know them and knowing what baseline is, which I'm sure we all have learned, you almost feel like a nurse, because you're just watching it. You're like this, you're trying to figure it all out, and then you don't get that regular time as like a mother or a dad or a sibling, It
was so hard. Yeah, it really is hard. Because it consumes a lot of your energy and your time, and then you're grieving, because you're dealing with this new situation that you don't know which way it's going to go. So yeah, it was hard. I'm sure you guys have dealt with the same thing in the beginning. And not that it changes, because I'm 6 years in, and 6 years in, we still have, feeling of grief and, being scared, and what if this happens? We have a lot of trauma. I have a lot of trauma that I live with, that it continues. It really doesn't kind of go away. And I know that we hit milestones every year. Like, oh yes, we're at the 6-year mark. Oh yes, we're at the 7-year mark. But we celebrate those same milestones as we celebrated the first year, the second year, the third year. It just because the time goes on, the fear is still there. And we're exposed to, just like you guys are. I'm sure and seen. You're exposed to parents that are grieving their children, the loss of their child and stuff like that. And those type of things are hard, because we take that all in, you know what I mean? So
and it's interesting when something sometimes just triggers out of nowhere, like you could be having a great day and something will happen, and you'll just be triggered into these moments where you could have a long stretch of feeling fine, and then all of a sudden just it comes out of the blue, and and then you have to deal with that. And
it's a bit like today.
It's hard. Yeah.
I was just going to say with Darcy having the UTI and that, and her being extra snotty, it's sort of cleared. She's had a UTI this week. It's sort of cleared up,
Yeah.
but she finished her antibiotics today. But she's extra snotty and dribbly and all that, and you get that mindset where you're like, oh, was something wrong, or that sort of worry all
Yeah,
the time,
exactly.
and it doesn't go, does it? It's
Yeah.
always there. Just
Yeah, it doesn't help. Yeah. Yeah, that's the thing. I guess people on the outside would see Aerilyns at her age and stuff like that, and feel like, oh yeah, you got it all together. You got it all worked out. You figured it out. And I'm like, no, that's not how it works. It's great. It's great that we're thriving and we're doing our stuff, but the trauma is still there. There's a lot of stuff. And one thing that I always tell everybody, and especially when I'm training people to come here and work with us, is that you can never, ever, ever, ever stay complacent. There's no such thing as complacency. There's no such thing as like, oh, we'll be fine. We're good. I don't need to put her on the pulse ox. I don't need to put her. I don't need to go the extra the normal steps that we do to to keep her safe and stuff like that. Because if we're traveling, I don't feel like bringing the suction machine today. Oh, maybe we don't need to bring the ambu bag. Oh, she hasn't had an episode in such a long time. There's no need for the ambu bag or the oxygen tank. That's a lie. That is a lie. Don't ever try to fall, you know what I mean? Like try to make things easier because you feel like.
I was going to say, I always make sure we've got the suction and all the stuff and everything in the bag. And it's like Darcy hasn't had any problems for a while, but I don't want to get caught out.
Yeah.
I'm just like, we've got to have this stuff all the time.
Right.
It's
exactly. Yeah, I agree. It's happened time and time again with us, at least, where Aerilyns goes through a long stretch being great. Everything is great. There's no issues whatsoever. She hasn't needed oxygen, hardly being suctioned. Her numbers starting at 100 O2 level, heart rate 110. Everything's great. And then 2 minutes into that, all of a sudden out of left field, she'll stop breathing. Then you got to run and grab the ambu bag, and then you have to, bag her and stuff like that. It's a very scary thing.
I wanted to ask about that. Is it the breathing? You said about breath holds. Does she have apneas where she can't breathe because of the issue that's with her lungs and throat, or is she stopping breathing completely? Because they're two different things.
Well, here's the thing. I listened. Yeah, it's very complex, to say the least. And I was listening to the last video that you guys, I don't know if it was the last video, but one of the videos that you guys were talking about the breath holds.
Yeah.
And I know with Darcy, it presents one way, and with Grace, it presents another way. So with Aerilyns, it presents very different from what I know that Darcy has her way, and then Gracie has her way. That Gracie, if she cries or something might trigger it. With Aerilyns, hers look very different. And the way that it's happened to us a few times is where the best way to explain it is if somebody turns off a switch, and then all of a sudden, the colors washing out, and there's no oxygen coming in or out. There's no twitching. Yeah, there's no twitching. There's no fighting. Nothing seems to, at least with those, because there's other ones too that she's had, but they're seizure related, where she's like holding her breath. It seems to be seizure related. Or if she's turning purple and she has a plug, that's obstruction, But the ones that she's had in the past, and it only happened a few times, a handful of times, like I said, like maybe 5, have been where, like I said, a light switch. I don't know if it's most likely neurological, because I've explained it 1,000 times to my neural doctor and my pulmonary doctor, because I'm like, is this pulmonary issue? What's going on here?
Right.
Because we're suctioning her, and it's not an occlusion. It's not, and then you guys done the, putting down the scope. It's not a floppy airway or anything like that, because, we're doing that with the trach. We're intervening and giving her the pressures with the trach. It just seems to be more central neurological, where things just like, it just shut down. It happened once to my nurse, where all of a sudden she's sitting there, and my nurse is jotting down notes, and she looks over, and then Aerilyns is gray. There's no color. There was not any type of like pre-warning that this was going to happen, and she had to jump in, and she had to bag her, and she had to stimulate her. She had to pound on her chest to try to get her to breathe. And she's sitting there screaming, like, breathe, and pounding on her chest and bagging her. And then Aerilyns came to, and then was never explained why it happened. And then it happened again. And like I said, for the 6 years that Aerilyns been with us, it's happened maybe 6 times, and very sporadic. And there's no reason why. Nothing happened the day before. It's not illness, because illness with her, she does have more seizures, and her heart rate will go up with illness, and she'll have holding spells or breaths, but you can physically see that there's a seizure going on, or if she's all of a sudden you start seeing her color change and her numbers drop, but she's like struggling. Sometimes those are sign of plugs, and then you have to go in and suction them out. So it's very complex. There's a lot going on.
She sounds very similar to Darcy's. Like,
yeah, okay.
Darcy would just stop and go grey, like you say. But Darcy would sort of gulp for air as if she's still trying to breathe, but it's like all this just stopped working.
Yeah.
But then she would pass out and kind of reset. But ours would happen when she's doing it. It happens sometimes several times a day. It would happen. It's really like, it's horrible thing. Because they look.
That's hard.
They look like death, don't they? When they go grey, and really horrible.
I don't want to get morbid or anything like that, but it really does look like they're dead. Like Aerilyns looks like she's dead. Like there's no coming back from it. And there was a few times that I even said myself out loud, is this it? Is this it? Like, is this the day? Is this the time that, because it's so scary and so, it's so scary. It's so impactful that you just don't know what to do. And like I said, we bagged her and stuff like that. We were able to bring her back. But
that lifelessness, like that, when that color goes, it's just this the body, crazy.
Darcy would always go, she'd do that and go stiff as well before she just passed out, and then to just be completely lifeless, like, it's horrible.
Aerilyns, like I said, those have been the hard ones to kind of debunk and try to understand why they're happening. Like I said, I do communicate. I have a lot of doctors and stuff like that we talk to. We talk to pulmonary, neurology, endocrinology, all the specialists at ologies, finishes in ologies. We've seen all those specialists. Yeah, and
have they got better with age at all?
Well, I don't want to say yes and no. It all really depends on her, because every season I feel like we're hit with something else. You know what I mean? Like, it's very hard to just like, we're like, wow, this is going to be a great year. We're not going to deal with any issues, blah, blah, blah. And then he ends up in a hospital. And since we've done the trach, I do have to say that the trach has helped a lot. The intervention of having the tracheostomy and stuff like that, and having that airway available, and bypassing, having a suction through the mouth and the nose and stuff like that has made life a lot easier. The respiratory therapies have made Aerilyns' sick time a lot less. So instead of being sick for a crazy amount of time, at end, she gets sick for like 1 or 2 weeks the most. You know what I mean? A lot of times so far we've avoided hospital admissions except for the other day, which that came out of left field. And I'm like, what's going on with you? She had a fever 103. And she was very funky and her color was changing too. She had a breath hold spell, I guess you can say, in the car going to the hospital. Her color was gray. It just didn't look right. So I don't know. I'm very suspicious when a lot of time goes by and we haven't had one. I get very suspicious and say,
I can relate to that.
You get on edge. You get on edge for a while. You're like, you start looking for things, and sometimes you freak out a little too early. At least I do. I'm like, oh no, and then it turns into nothing, thankfully. But yeah.
Well, we used to have them weekly. I mean, at one point it was like every weekend for some random reason. And now she hasn't had one since the beginning of the lockdown. So we're like, it's a long time.
Well, I think that, what we try to do, and when we're trying to take care of our little ones, is we're trying to be preventative,
Exactly.
that we do is to prevent issues or hospital stays. And I don't think they understand the intensity of, their actions or other people's action and how they affect our children.
Exactly. Yeah. What's a sad truth is a lot of times when Aerilyns has been sick and stuff like that, it's because somebody either brought it home or my kid brought it home. You know what I mean? Like, because somebody sent their child to school with some illness, then Elias picks it up and of course he brings it home, and then things like that. Or if my nurses don't realize that they're sick and they think it's allergies, they get Aerilyns sick, and then it's a whole domino effect of, and like you said before, Dee, that a lot of this is just trying to prevent something from happening. So a lot of this work that we do at home with the respiratory therapies and the medication and it's all interventions to prevent from something getting worse or from something happening. So a lot of the stuff that we do at home too is because of that. Is we're trying to prevent her going to the hospital by doing all these respiratory therapies. We're preventing her. It's not that she's sick. It's not that she's having a hard day. It's just that we're doing things just to kind of prevent from happening. Because once they hit and once it happens, a lot of times it really debilitates your child. And then if I go through the history of Aerilyns' Instagram account, you guys can see, there was a period of time where she was living in ICU, and
it's like when the coronavirus started, and they're like, "Oh, you got to gel your hands." We're all like, "No, we do that every day anyway." We're pros. This is everyday life
so
for us.
This is typical. We quarantine all the time.
Yeah.
We quarantine, and we were afraid of. What's so funny is that so when the flu season comes around, and I'm sure you guys kind of feel the same way. When the flu season comes around, naturally for us at least, we have this oh my gosh, this fear. Like, this the flu season. I hate winter. I hate when the flu comes around because Aerilyns can catch it or whatever. And then when this corona thing came up about, everybody was freaking out more so for me and Aerilyns. And I'm like, listen, we're fine. We'll be fine. Well, we know we're doing the stuff that we need to do, the precautions. Of course, we're scared. I mean, there's a lot of fear in this new virus and how it's affecting the world. The death toll is real, but we lived like this for a long time now, washing our hands, wearing masks. It's not the first time we wear masks, and so keeping our distance, keeping alert on who's been sick or who hasn't been sick. We've been doing our own checklist since way before the corona.
I think our biggest concern when coronavirus hit was the shops selling out of antibacterial gels and things. That was a concern.
Yes.
Yeah, that was
Suddenly
hard.
everyone
Yeah,
was
that
buying
was.
it.
I'm gonna give her a quick section because she's at 84. So that's what the pulse ox says. I don't think
You
true.
do too.
You do what you need to do.
Oh yeah, I'm used to that. That's like nothing. But it is so true that hi Grace. But by the way, I'm looking at Grace over here.
See, Darcy's asleep now, I think.
Yeah. She's
quite late.
like,
It's
yeah, I
getting
get
late for
that
Darcy.
section. She's like, yeah, I know suction. Yeah, I know.
Darcy's a nightmare to suction at the moment. Like you put it, she's grabbing it, or she's she wants to fight all the time.
Or she's fighting it.
Fights everything. You put your finger near her mouth, she'll bite it.
Yeah, Grace is doing this.
Oh my goodness.
Where she keeps moving it so she can get the air, and then she starts talking, and then like the pressures, and she's like setting off alarms. I'm like, can you stop doing that? Like. But it is true with
Aerilyns.
With COVID that when people were like staying home and these stay-at-home orders, and I was like, this is nothing new. This is our world. This is what we do every day.
Exactly. That's what we do every day, and that's what there was a level of sacrifice that people are just having such a hard time doing. You know what I mean? And it's just
hi,
so
Grace.
Cute. Hey, Grace.
You say hi. You say hi
Oh my God.
You say hi today.
So cute.
You can say hi.
Oh.
Yeah. You gonna say hi?
I love these babies.
I've noticed a lot actually that a lot of our children seem to do the same things with their hands, like resting here, or that.
Yeah.
There's a lot of traits that they share that are very similar in the way they sort of
They do.
act.
Crossing the legs.
They do. I mean, it's with the crossing the legs. Yes, Aerilyns is infamous for that. She'll, very dainty. Will throw her leg over with a hand. She'll move her hand and stuff. So,
say hi.
It's really funny.
I think what we'll. I was just sitting there thinking about a future video as well. I think we'll have to get you back on and maybe talk about maybe have a talk about the things like the G tubes and that, and feeding, because I don't think we've actually gone into that too much.
I would love to talk about it. No, I would love to talk. We have so much to talk about.
Yeah.
Whenever you guys never stop with the videos and topics. I mean, you can even touch a topic several times, and it's so different for each of us. And that's the great thing about sharing all our experience, is that you just gain more knowledge.
Yeah, totally. And more to the point, we're putting more knowledge out there for other people to gain. That's the goal.
I honestly, when you guys were doing your videos, and I caught on to what you guys were doing, and I was listening to it, I'm telling you, it really does help so much just to listen to the perspectives and the experience that you guys are dealing with, having the same diagnosis, but you guys have it differently with the holding of breath and stuff like that. Because I asked doctors, and some of this stuff they won't know. If it's not in their textbook, black and white, they're not living it. They don't know. So I'm glad that
we've gone into appointments before where they've got like a page up about Trisomy 13 on the screen and reading it,
Yeah.
And it's like, do you know what you're talking about, or shall I help you?
It's like, I don't know. There's a lot of that's not right. And that's why I appreciate my specialists, because I've gotten really spoiled with the doctors that I have and the specialists that I have, because they let me, it's a teaching hospital, so they have a lot of residents, and they have a lot of, that are doing their clinicals and stuff like that. So they'll be like, here's mom, Mom knows everything about trisomy 13, and I'm like, whoa, that's a lot. That's a lot of pressure. And they're like, she'll explain, what's going on and stuff like that, and then they walk away, and then I'm sitting here with a student or with a resident, explaining how it presents in Aerylyn. Of course, I'm very, it presents this way in Aerylyn. Not all trisomy children have the same, issues, but at least I have the opportunity to kind of give my point,
I feel it might be a later topic to talk about again in another video. But what was the other diagnosis you said that she has? Monosomy?
So Aerylyn.
I can't say
So
it.
yeah.
What?
Yeah. So sorry, I'm sitting here like leaning into it. So yeah, I mean, we could definitely talk about it, and then this way I could get more information for you guys. But Aerylyn has 2 diagnoses. So I mean, basically, there's 2 genetic issues with her genetic makeup. Trisomy 13, which is, that's what you guys know and are living with, as well. And then the monosomy 15. So on her 15th chromosome, she's missing a piece of chromosome.
Okay, so
And then I have a translocation. So when you take my genetic makeup and you put it on a chart, you see that on my 13th chromosome, half of my 13th chromosome is missing and has swapped with my 15th chromosome. So I have,
Wow.
have any information missing. So I guess that's why I'm like this. I don't know. I don't know why the translocation, when you have a translocation, you're considered a carrier, but there's no.
So you kind of have all the information there, all the genetic code, but it's just changed places. It's still
exactly. So they change places, which is interesting. It's very interesting because it wasn't until when I was pregnant and then the geneticist came out with the sheets of paper information and stuff like that, and then they broke it down to me. This is your carrier because of such and such reason. Now, from my understanding, you don't have to have a translocation in your genetic code to have a child with trisomy 13. But in my case, because my family, we have, I guess, a lot of this going on, I'm a carrier. So if you look at my genes, you can see where they kind of swap places, which is, very unusual, very rare. They swap places, but my information is still there. But with Aerylyn, she has information that is missing, and then she has a whole new set of information that is extra to her 13. So I'm gonna see if I could break out the correct information because it's been a while since I've looked at it. But I'll get that information for you guys, and then maybe the next time, if you guys will have me, we can talk about that. And I wonder,
it'd be great to.
I don't know if you guys like. It's up if you guys want to share it or not. But I don't know if you guys know about your chromosomes. Have you guys had chromosome testing, or like what do you guys feel about that?
Oh, actually, I haven't had chromosome testing. I've had my genetics done though, sort of what's the words? Can't think of the words. But you know the company 23andMe. I had my genetics done.
Yes.
I had a health report.
Oh, I'm dying to do that.
It's really interesting, but I think anything might have flagged up there. Maybe if I had something, I don't know for sure, but it's quite an interesting thing to do.
Can I admit something to you guys? I wanted to do a 23andMe just to confuse the crap out of them and send Aerilyns DNA and be like, oh yeah, let's see if you guys can figure this one out.
Get the health report as well.
Have her spit and send that information in and see what they could figure it out.
Yeah, so awesome. I'm supposed to have mine done. I actually have an order. I gotta find it. You reminded me.
Okay.
So because Grace is technically not our first, like I had a miscarriage before her. I would say November, I think it was like in August. I had a miscarriage before that.
I'm sorry to hear that.
And even one earlier before that. So they were somewhat like concerned, like, oh, you know, could you actually have something in your gene that would, you know, potentially make this so it's hereditary.
Yeah.
But I haven't done it yet. But we don't have, when we went to our genetic counselor and we went through all our history of lineage, we don't really have anything that would just automatically have them speculate like, oh, it could be hereditary. But I am curious to find out, and I still have to get that test done, just to double check, because we've definitely talked about, you know, whether we're gonna have other children, you know, because she's our first, really.
Yeah.
But yeah, because you know.
When we found out about Darcy's diagnosis when she was 2 weeks old, I told you before, they gave us a leaflet saying, basically, don't worry, you can have another child, and the chances are they won't have trisomy 13. This is, you know, that's the sort of stuff we face, isn't it, when these hospitals and that. I'm amazed you didn't get the same leaflet, Deanna.
I probably did, and I probably just stuck it somewhere. Like, I don't want.
We've got like a book of Darcy stuff now, leaflets and letters and everything.
All the information that we got thrown our way, we've done the same thing. We just kind of take it, shove it, and just move on, because, you know, it is what it is. Sometimes everybody's different, you know. And we, like I said, we had in our family so many, and my father's side, that it was, you know, we kind of understood that was where it was coming from, you know, from my father's side and stuff like that.
So did you have any other? I hate using the word survivors because I feel like that's pushing fate a little bit. But did you have any other long living
with my family members?
Yeah.
Yeah. So it's hard because before I was born, we had a child with trisomy 13. So they didn't know it was trisomy 13 right away. Until, you know, she wasn't meeting the mark and stuff like that. And I think I want to say she was up to 6 years old or 5 years old. Yeah. And then she didn't make it. So then all of our family members on my father's side got tested. And my father was a carrier. And then I somehow got tested when I was a child. And I was told that I was a carrier as well. And so the information was there. And, you know, then on my father's side, his nieces and nephew had children. So I had one nephew that had, his nephew that had one child, and she passed at the age of 1. And then I have a cousin who has 2, but recently one of them passed. So Aerilyns, and then one existing survivor with trisomy 13. Now I don't know too much if there's any more. I just know from that, from the information that, you know, because here's the thing. I know a lot of people are like, well, why don't you know so much about it, and about your family and about trisomy? The thing is that I kind of took the steps to put this information out there. Not everybody is comfortable with talking about disability and stuff like that. And I learned that early on, that a lot of people don't like to talk about the disability. They don't like to talk about special needs. It's a taboo. So for a long time, a lot of the information was not very out there, at least in my family and stuff like that. It wasn't really out there for whatever reasons. Everybody has their personal, and I don't knock anybody for not, you know, sharing that information. And then when Aerilyns was born, I guess I made the decision somehow, one way or the other, to be honest and upfront about what was going on, because I realized that staying in the dark was not helping me at all. I spiraled into like this deep depression when I was pregnant with Aerilyns. I think from the 6 years of our entire journey, my pregnancy with Aerilyns was the hardest. Like that was the hardest because I didn't know. There was a lot of whys. Why me? Why this? Why is this happening? What did I do to deserve this? And all this other stuff. And I have, I lost my faith, which I never my entire life lost faith in God. And I did. I lost my faith in God. I didn't believe anymore. I was like, no, that's it. He doesn't exist. I was too good. I was too of a, I was following my, my moral compass and trying to stay as the best person that I could be in. And so that was a dark time for me. So I could understand why people don't want to share. But once I made the decision to share, and then I had like a spiritual intervention with God, which this is for another story. This is for another video. But, sharing Aerilyns' story is what basically is our lifeline. So, and that's why I appreciate you guys for sharing what you guys go through with your kids. And
sharing Darcy's story kind of is part of my keeping sane thing. Like if I feel like I'm helping others, I feel good about that. So
yeah,
that's
yeah, absolutely.
The dark times.
You guys,
it helps me.
There's positive out there, and that we're not alone. I think that's also helpful.
Yeah.
Knowing that we have other parents that can relate to us. And I really appreciate you sharing that, especially about your family history, and that's something that is hereditary. I know that's so personal, and I think it will definitely resonate with others who are, in those same situations. So thank you.
Yeah, I hope so. Yeah, you're welcome. I hope so. I know that, like I said, there's a lot of information I didn't know until Aerilyns, just because everybody has a different level of comfort when it comes to sharing their information and stuff like that. And when it comes to sharing something so deep, like a diagnosis, you know what I mean? Like a diagnosis of trisomy 13. So but I think Aerilyns has helped. At least I've seen some change in my family for the positive, you know what I mean? And so, yeah, it is what it is.
Great.
Definitely a lot more to visit in later videos with your story. I'm gonna have to come off this one in a moment.
Why don't we wrap up, and Larry, you close it out, and then I'll stop recording.
Everyone's eating around me now, and I'm like, it's that time here.
Right, I've been venting Grace from her G-tube right now as we're all talking. I'm like,
I've really enjoyed this. Thank you for coming and talking. I've really enjoyed this chat.
I enjoyed listening to you guys. I really appreciate having me on, inviting me.
Well, like I say, I still think there's so much more that we can talk about with you, and I'd love to sort of do it on some future videos. And
yeah,
because
me too. Yay. Me too.
All right.
I agree. Well, thank you guys.
Thank you.